Another question that's come in for discussion is, how will people be notified that Data 2020 has been launched? To answer that question, Rebecca Hines from the National Center for Health Statistics is on the line. Rebecca?
My understanding is once we have the system up and running that we will use the social media that was just discussed and promoted here on the webinar to let everybody know that it's live. But of course, anytime you visit the website, early next year, January, February, hopefully you'll start to see new features when you go to topic areas.
Great. Thank you so much, Rebecca. Another question that has come in is, how are the targets for Healthy People 2020 objectives set? Or Carter, would you like to respond to that?
Sure. We took a different approach with Healthy People 2020 than we had in the last decade with Healthy People 2010. And those of you who are familiar with Healthy People will remember our very ambitious targets from the past decade, where we used a term called better than the best that resulted in setting targets for each of our objectives that drove progress for all population groups that was better than the highest level that had already been achieved at the baseline. We had a federal advisory committee guiding the development of Healthy People 2020, and this group of 13 non-federal experts led by Jonathan Fielding from LA County Health Department recommended to HHS that for 2020 we take the approach of setting targets that were realistic and achievable, yet they still wanted to see somewhat of a reach. So we ended up kind of going back to the drawing board, and we set what we call a default target setting method of 10% improvement over the baseline. That standard or default target setting method was used in cases when we didn't have trend data to accurately project or model where we would be by the end of the decade. We also required the objectives to be consistent with existing national policy, programs, regulations, or laws. So if there was something that was previously mandated or established, the objectives will use whatever target that happened to be. Another option would be to maintain the baseline measure, and this would be in cases where something is, an objective is trending or spiraling down rapidly, but we want to at least maintain the baseline. We don't want to see any further poor results. We used minimal statistical significance in setting targets. I mentioned modeling and projection and trend analysis. In some cases, we actually retained the Healthy People 2010 target if that seemed to be prudent for policy reasons. We also use something that we call total coverage and total elimination when we're trying to reach essentially 1% of 100% of whatever it is we're striving for. And then there were a few odd cases or difficult cases when our baselines were either very, very high, for example, close to 100%, or else very, very low. And in those cases, a 10% improvement would not have been feasible. So we required or permitted the objectives to use either a 2 to 4 percentage point improvement. So this is a new approach for us in setting targets, and we will see the results of that at the end of the decade when we finally calculate our progress.
Thank you, Carter. If you have questions at this time, please go ahead and use the Q&A function on the right-hand portion of your screen to submit them. Another question that we have is, when it comes to your social media, how do you know what works and what doesn't work? Jordan Broderick here in our office is going to answer that question.
Thanks, Emmeline. Really, with our social media, we watch and see what people respond to. So with our Twitter, we definitely monitor and see, are people retweeting it? Are they responding to what they say or to what we say? We track all of these different aspects on each of our social media platforms. So on LinkedIn, we'll put discussion posts out there, and we see if does it spark discussion and how much discussion. And we try to pay a lot of attention to what types of things cause discussion. So is it a certain topic area? Is it how we phrase a certain data point? We really try to monitor all of those different elements to find out what works and what doesn't.